Everyone. Lovely to see you. And I'm just going to invite Carys. So welcome to this. I think this is the sixth Two Doctors Chat Menopause. Alcohol and menopause. So very relevant topic with Christmas coming up. Hi, Carys. Lovely to see you.
Lovely to see you too. How are you?
I'm very well, thank you. How are
I'm
you?
really good. Thank you. Yes, really, really good.
How's your week been?
It's actually been really good. And today, well, we were just chatting before, weren't we? But today, actually, I forgot to say to you, I received in the post my weighted vest. So I've now decided to doing my strength training, which I'm thoroughly enjoying. I don't really like having weights on my shoulders. So this weighted vest is 10 kilos. So that's my new thing of the week to increase my strength exercise using my new weighted vest.
Ah, yes, I think I saw someone on Instagram wearing one of those. I was very intrigued. You'll
Yeah,
have to
I,
keep us updated.
I will. I will let you know. What about you? How's your week been?
My week has been really good. I went to London at the weekend to see some family, which was very nice. And then this week, I'm proud of myself. I've been to the gym twice already, doing my weights. So yes, that is going well.
We're making the
um,
most of the new advice, the nice guidance
yes.
advice, aren't we, with the real strength training? And actually, I feel a lot better. I feel a lot better. Back pain and
Mm.
things a lot better. So it's good. But today, what are we talking about today?
So yes, I was just saying today we're talking about alcohol and menopause, and I think that's certainly a topic that's quite relevant in terms of what we see in clinic, isn't it? Not for everybody, but certainly we see alcohol being something we often talk a lot about with our patients. Some people saying that they can't drink alcohol anymore because of their symptoms, other people finding symptoms worsened by alcohol, and then we also have the longer term implications, don't we? So I don't know what your experience is in relation to sort of the things you see in relation to alcohol and perimenopause and how it shows up.
That's a really good question. I think the patients that I see find it hard. They don't feel well often when they drink alcohol, and that's a real change for them. But also, interestingly, some of them turn to alcohol in order to try and calm down, because we know that alcohol binds to the GABA receptor,
Mm,
which is our lovely calming neurotransmitter. So some of the questions I often ask when I see people who admit to drinking on the threshold of what we know is the government advice of we should drink less than 14 units a week, and we should have some days off of drinking. So make sure we have at least 3 days off. But when people write 14 units a week, very often for us as doctors, we assume that actually what they're drinking is more than that. And it's really important to make sure that that person has an understanding of what a unit is, because sometimes people will say to me, "Oh, I'm drinking, maybe 12 units," but now I've started to ask exactly what do you drink and how many bottles of that do you have a week? Because it's more easy for me to understand how much you're drinking if you tell me how long a bottle would last you, or how long a bottle will last you if you're sharing it with someone else. Because then it gives me a little bit of a better idea about how much is actually going in. And sometimes people will turn to alcohol because they just feel so stressed. So they love that GABA calming experience, but what then they really don't enjoy is the effect it has on the rapid eye movement, sleep, and consequently the emotions the next day. And they don't enjoy the headache they wake up with. And they certainly, if there's someone who experiences histamine-like symptoms, don't enjoy the histamine symptoms that come with drinking alcohol, and also other foods that can increase the level of histamine. And during perimenopause, that can be really troublesome for lots of women. And it can affect mental health, can't it? And
mm,
risk of risky behavior. So doing something, making decisions that maybe you wouldn't want to, and also risks of cardiovascular disease, liver disease, cancers. So it really has lots of implications. And it comes down to the question of, is there really a safe limit? Is this 14 units something which is safe? Is there a benefit to drinking that glass of red wine that we think, there might be? I mean, there are lots of questions, aren't there, really, about this. What's your experience?
Yeah, definitely. I think like like you, we see women who turn to alcohol to help them navigate the challenges of perimenopause and menopause. And in lots of ways, alcohol is really good, isn't it, in the very short term for dealing with, that feeling of anxiety, sometimes the pressure and stress that life brings. And certainly, we know that menopause, perimenopause reduces our resilience to stresses and ability to cope with things that we previously would have handled without issue. So because of alcohol's immediate short-term effect, it can be a really good short-term reliever in that moment, but then very quickly we see that it can exacerbate symptoms. It worsens anxiety over the following hours and days. We know it's a depressant, so it worsens mood over the following hours, days, weeks, because of the impact on GABA and how it all interacts with the other neurotransmitters like serotonin and dopamine, and the interaction with that. I don't know about you, but we see a lot of people who have ADHD. They're experiencing increased ADHD symptoms in perimenopause often, and sometimes for that cohort of women, alcohol is something that's turned to, particularly with that increase in sort of dopamine seeking actions. And so again, in this population, the symptoms of perimenopause, and then as a result of alcohol, can be increased. So it's causing lots of additional sort of symptoms. The studies tell us, don't they, that alcohol worsens hot flushes, it worsens anxiety, it worsens palpitations, for example, that some women experience. And we know for everybody it will impact on sleep quality, which, if you're already suffering from broken sleep, difficulty sleeping, alcohol is often just making that worse. Some people say that alcohol initially helps them to sleep,
Yeah.
but we know that even if it does help you to fall asleep and sometimes stay asleep, we know that the quality of that sleep is poor. Like you say, when people aren't getting the REM sleep, the deep sleep that's properly restorative. Um, so ultimately, it's having a negative impact on that. And I I certainly see as well, again, a group of women who perhaps previously enjoyed drinking alcohol socially, and then because of the histamine and because of other side effects that come with it, it's just not tolerable, and it's just not enjoyable.
Mm.
I suppose the other thing as well that I think is particularly relevant with this is, some people, don't they, experience side effects of HRT. And because estrogen, when we're using estrogen, or if in perimenopause when we've got those high levels of estrogen, because estrogen is, my simple way of explaining it is, estrogen is detoxified by the liver, isn't it? Once it's broken down, we need the liver to be functioning really well to get rid of the broken down estrogen. If your liver's busy mopping up all the alcohol and dealing with alcohol, say at a weekend, say you're having drinking socially, we know as well that then side effects of HRT, or in complications from those high levels of estrogen in women with perimenopause who might not even be on HRT, we know that your body's having to work extra hard. So it makes a lot of sense that those side effects or consequences of drinking alcohol in the short term will be exacerbated, even if, for example, someone is sticking to that 14 unit
Yeah.
limit, but you're having maybe on a Friday night, Saturday night, it can really sort of exacerbate those symptoms and side effects for a few days afterwards, can't it?
Yes.
Um,
Yeah, I think
um,
that's right. And I think the risks of future health conditions are also something to consider So it's an interesting thing, isn't it? If we look at the history of drinking alcohol now, because I had a really interesting conversation with someone recently, and she was saying it's actually really difficult because of the sort of expectation with the socializing that goes on around Christmas. How am I actually going to be able to do this? You know, to sit to I can really see that alcohol is impacting my symptoms, and actually metabolically for her it was really important that she reduced down her alcohol, um, but she was really unclear about how she could go about that. So things that some people, in my experience, this is not evidence-based, I don't think, but in my experience of being a GP for 25 years, some people simply can reduce a bit, and other people absolutely can't. They have to stop. There's no way they can have a little bit less. And actually, for them, even living near a shop which sells wine is, or wine, well, if that's what they're drinking, is really hard for them to the addiction is really difficult for them to stop. So it's trying to find ways, thinking what will work best for you. Everybody's going to be individual. And some people find the non-alcoholic drinks, of which there are now in abundance, aren't there? Really good. So they enjoy drinking those if they want to choose something that tastes a little similar. And other people find they just want a treat, you know, something, if they were someone that enjoyed that treat, they just want to have something in a lovely glass. And it doesn't have to be alcoholic, but it could have, you know, some fruit in it, or a little, umbrella stick or something, which makes them look forward to it. And they've said, oh, actually, that's what I do. I've decided now I have a special something which I'm looking forward to, as I was looking forward to the drink I was having in the evening, but now I have something different to look forward to. Or I keep myself really busy at that time of day, or I cook early, or I just don't let myself be in the situation that I would have a drink. I had a lady who was strangely, she was actually, not strangely, because lots of people do this, she was having a glass of wine when she was cooking, because that's something that lots of people report they enjoy. And it wasn't very long before she ended up on intensive care on the liver unit, because she had started having a couple of glasses of wine while she was cooking, and then it became too much. And it really, she said, it's just so easy for people to do this, you know, but they suddenly start to drink a little and then it goes up and up. So I think for her, it was something she had to stop. Some people can reduce, but others simply just do need to stop. So, and if you do find that you're really suffering with an addiction, and something that you're actually really worried about, and maybe you're drinking in secret, or I did see there was a stage, it was somebody, it was actually a lady on loose swimming, and they were laughing about the fact that people used to have wine in a cup, so other people didn't know that that's what they were drinking. It would look like a cup of tea. You'd get to the stage of the evening where maybe you're putting your young children to bed, it's been a long day, and then you're almost hiding the fact you were having a glass of wine by making it look like you're having a cup of tea. So there are lots of things that people do or feel they need to do in order to drink. And I think sometimes it's just facing the fact that actually this isn't what I want for myself. This is actually making me a lot worse. And now how can I go about getting some support in order to try and reduce or stop if I can't do it myself? You know, if I'm hiding it from people, if I'm, you know, buying it and keeping it in the cupboard and not telling anyone I'm drinking, or there are lots of different levels, aren't there, to
Yes, there's a
cope with
huge
substance.
spectrum, isn't there, in terms of
Mm,
al alcohol and alcohol being problematic. You know, there's the people who, you know, actually aren't really drinking very much, but it just makes them feel poorly
symptoms
when they
worse.
do drink it and they want to stop it. There's people that drink socially, and then there's people like, you know, you described that lady you were describing, where alcohol is getting more and more worrying. Um, it's getting more and more impacting on their day-to-day routines. Maybe they're having to change their routine so they can drink, hiding it, like you're saying, popping it in the cup, you know, not being able to do their normal things if they're not having, you know, that they would, where they would normally have a drink without a
Mhm.
drink. Or those people who, you know, as GPs, we we see this a lot more commonly than I think people expect. I think people think that if people have an alcohol problem, they're not necessarily functioning, they're not able to go to work, they're lying around in bed all day. But there's a significant number of people, isn't there, who actually are drinking in ways that are problematic and going about their day-to-day life, and perhaps only people close to them have realized. I think one of the other things that can be a sign of that is if you get some even just mild withdrawal symptoms if you don't have a drink for several hours, or over a day or something. And I think those things that you mentioned, hiding the alcohol, having drinking more and more, to get the same effect. The withdrawal symptoms, if it's getting hard to stop, I think these are all things that are good indicators that perhaps actually seeking some help soon is really, really important. And I don't know what it's like in your area, but where I work as a GP, we have alcohol services where people can self-refer and receive support and guidance to help with that. Then there's obviously Alcoholics Anonymous for people who align with that approach and feel that sort of support would be useful. And you've given some really good tips, haven't you, just for people who actually they're not at that stage where they are addicted or even sort of dependent on alcohol, but actually they're wanting to start to reduce it, for their health, for their symptoms, just because it's something that they want to do, which I think is really, really useful. I get migraines, so I personally don't drink. I haven't drunk for a little while, a few years, and I find for me particularly if I'm going out, the alcohol-free versions of drinks is really good when you're around other people, because people aren't necessarily questioning. There's no conversation around, oh, why are you not drinking? Makes it a lot easier. But like you say, sometimes the non-alcoholic cocktails that you can get, sparkling water with a bit of ginger, cordial,
yes,
and there's so many options. I think particularly with younger people, there's a lot more. It's a lot trendier to not drink. I think it's more sort of the sort of people in their sort of late 30s onwards, where drinking is much more of it's much more fashionable, if you like. That's how we sort of grew up drinking, but I think it is changing for the younger generations. I was going to ask, is it worth just briefly mentioning, obviously we worry so much, don't we? Or people, there's so much worry around HRT and the breast cancer risk, but do we want to talk a little bit about alcohol and how cancer risk is implicated by that? Because actually that's more significant from a breast cancer perspective than HRT is, isn't it?
Yeah, absolutely. So if we're looking, we of course we worry about cancer, and we worry about any modifiable risk factor. So when we're looking at risk of breast cancer, we have a chance in our lifetime, a lifetime chance of getting breast cancer, about 1 in 7 of us, haven't we? So through our lifetime, 1 in 7, 1 in 8, and that risk increases as we get older. So age is a risk factor. Another thing and we can't do anything about that, so we are getting older. Another thing that's a risk factor is our family history. So the number of people in our family and the age at which they were diagnosed. If we have Jewish heritage, if we have a complicated pattern of cancers, if we have male cancer, bilateral cancers, those things can increase the risk of breast cancer. Plus different family members. So we have multiple members that may increase our risk. And we also then have these modifiable risk factors that we can actually choose to do something about, haven't we? So we can choose how much alcohol we're going to drink. We can choose whether we smoke. Our weight is implicated as a risk factor, and that's probably the most important lifestyle risk factor, isn't it? And of course, we gain weight as we get older, and we gain weight as we go through menopause. And we're not to discuss weight now. Weight is very complicated, and some people would say it's not a choice. And of course, I'm not saying that it is, because it can be very difficult to lose weight, but it is something that is implicated in risk of breast cancer. And exercise, which is very protective for breast cancer. So actually, we know that if we're looking at lifestyle, HRT risk for breast cancer is about the same as drinking a large glass of wine every night, isn't it? So we're looking at matching the risk with that. If we're looking at what HRT would do in a general sense, to adding to our risk of breast cancer, and we're talking about using both hormones, estrogen and a progesterone or a progestogen, when we're talking about this. So there's some really good, actually the NICE guidance have got really good infographic about the risk of breast cancer when we're coming to look at combined HRT or estrogen only HRT, when it comes to risks and benefits, when it comes to looking at health conditions like breast cancer, like dementia, like osteoporosis. So it's really helpful to see a pictogram of that, which is really, really good. So I think when we're looking at the choices that we're making, I think it's just important to consider what we're doing and to have a really good conversation about what we're doing, sometimes with someone who's really happy to listen, to have empathy, to understand. And this week I had the most wonderful consultation with someone who's actually was incredibly symptomatic. At her first consultation, she had metabolic syndrome, she had hypertension, she had waist circumference was over 100. She had high lipids. She was on antihypertensive medications, and actually with lifestyle choice and with the right type of hormone replacement in super low dose, she totally changed it around. She really lost 7 centimeters from her waist. Her blood pressure was coming down. She was losing weight. She'd really looked at all her lifestyle parameters and look at the choices she was making, particularly even though she thought her nutrition was good, she decided to see a nutritionist just to make sure that was optimal. So I think it's important to say we do have choices. It's not easy to do everything all at once, and that's certainly not something which we would advise, usually taking small steps and choosing things which are easy, and making life easy for yourself whilst reducing risk so that you can feel better and suffer, and your symptoms are improved, but also notice that your health is improved and your risk of future health conditions are also improved. So it's really important, I think, sometimes to sit down and say, look, really quite honestly, this is how much I'm drinking. And one thing that we will also say with this, although risk of breast cancer is something, it's osteoporosis, isn't it? So I have actually referred people for DEXA scans because their FRAX score has considerably increased with regular daily alcohol consumption. As they said, look, I've got to be honest, this is how much I'm drinking. So I said, look, I don't want you not to be honest during a consultation. There's never any judgment with it. We'd love to know what you're doing, and we need to then act upon that. And they've been diagnosed with osteoporosis. So just through not maybe it's been implicated as a risk factor, hasn't it? So it's something really useful to know, because then you can actually do something about it. And sometimes these things they creep up, don't they, without you actually really realizing what's happening. You're having maybe a glass once a week, suddenly it becomes a bit more. Or we haven't spoken about binge drinking. Sometimes people don't drink very often, but when they do drink, they may drink a tremendous amount, which then means that they are at risk of risky behaviours and putting themselves at risk of making decisions maybe that they wouldn't have made otherwise. There's lots of ways we can drink, aren't there? Not just the person who drinks with one, a regular drink. Could be that someone's drinking just once every week or two, and actually they're drinking a lot. So that's also the type of drinking that we want to avoid. So I think this, when we come down to it, I'm sure that we need to know. I think somebody had said that there was a study going on at Surrey University. I saw a little bit at the bottom of the comment about the benefits maybe of drinking alcohol as part of a Mediterranean type diet. Is that what they were saying?
Yeah, I mean, I think yeah, that's what I saw. There's a study going on the anti-cancer benefits of red wine. I don't know. Yeah, I think it sounds like there's obviously
Lots of things
ongoing
we need to
research.
understand more.
I also had heard and read in that some of the benefits around alcohol, and I think it's particularly the resveratrol in
Mhm.
red wine, had been over promoted previously
I heard that too.
by the alcohol companies and supported by the government, because also, you know, there's a lot of money to be made in alcohol, isn't there? Um,
Absolutely.
so I think we need to be mindful of the messages that sort of are being given to us sometimes. It may be that newer research has come out since that I'm not aware of, so that might not be
Mm,
entirely up to date. I think as well, I think also what we're saying, you know, we're not here to, you know, vilify alcohol or make anyone feel guilty because they're enjoying a glass of wine at Christmas at all, are we? I think
no, no,
it's just about having that
being
it,
mindful.
yeah, I think, you know, opening up the conversation so there's awareness of how alcohol and menopause might interact, how it might affect people. You know, we always say this is a time to, you know, like you're saying with that lady, it's not just about menopausal symptoms. This is a time to reflect on general health, our other health factors,
Mhm.
other health implications, and, you know, just if actually people just, you know, can be reflective around, you know, what they're drinking and how it's making them feel, how it's contributing to their health. You know, if you really enjoy a couple of glasses of wine on a Saturday night with your friends and it's really enhancing the experience for you, and that's feeling really good, and you're, you know, yes, you might wake up with a little bit of a headache on Sunday morning, but it's completely worth it for you, then that's absolutely something that, you know, there's no
You've made that
judgment
decision
around. That's,
actively. Yeah.
yes, when we can make those mindful decisions,
Yeah.
then in the context of everything else, and think about how we can support ourselves best, it may be that the occasional couple of glasses of wine is something that's supportive of your overall well-being. But it's when it creeps past that, or we're not aware, or we're not in control of it,
Yeah.
or actually it's, when we look at things, it's actually much more, it's not just a couple of glasses, is when things might need a little bit more consideration and thinking about it.
Yeah, I agree. And that question at the bottom. So, what is your view on resveratrol in a form of supplement? Gosh, I don't know that I could quote any evidence about studies of that. Um, so, and I I find that it's easy for people to consider taking supplements in order to try and um, protect their health, or in order to supplement maybe poor nutrition or deficiency. But I think there's a massive conversation about supplements, and also about the concern about taking supplements unless they're taken on an individualized basis. I generally wouldn't advise that that was the case unless you were working with somebody who had looked at your, I'm talking about maybe Live Code GX, or looked at your actual DNA and saw what you were, what your DNA was doing, and you were working with a nutritionist who was really experienced. I would say they would be able to help you, but you probably have to look at some studies just to make sure that you were, that you what you were doing was correct. So I don't know that I can answer that very helpfully, I'm afraid. Sorry.
Um,
Um,
yeah, because I think that there's a lot of substances and things that might be helpful and beneficial for health, but a lot of the studies looking at those benefits or supplementation with those aren't looking at the long-term effects necessarily, are they? So we don't know the impact on the liver or the kidneys, for example, with
no.
long-term use of things. So it is very difficult, and I think a lack of good quality evidence around supplements, which is very, it's not on the same level as what we need for medications and things. So it is very difficult, I think, to advise around substances. And there is one question about somebody who's been experiencing perimenopausal symptoms, vasovagal symptoms, and low estrogen on day 5, low testosterone and high FSH. That certainly would sort of be fitting with a perimenopausal picture, wouldn't it? And I think certainly my recommendation would be that that's something sort of definitely worth discussing with a doctor if you've not done so already. And it might be something where, you know, HRT is part of that discussion, you know, in the context of lifestyle, but certainly certainly discussing with your doctor about what the options might be for you as an individual in the context of your health would probably be really sensible there, if it's something that's causing problems. I think we've covered most of sort of alcohol.
We have,
haven't we, Carys? Is there anything that I've not mentioned or we've not covered?
no, I
Covered
think
yet?
what we could do is we could put in the link, because this will go on to our Instagram and also our YouTube channel, won't it? And we could put on the things like the questionnaire, the fast alcohol screening test, which I've just got in front of me, just some questions that you might want to do and you might want to look at. It's got a really good diagram at the bottom with reference units of what 1 unit is, and with drinks of more than a unit, so how much is in a bottle of wine, for example, just so that you can, I think it's just about being mindful, isn't it? So we can think, okay, well, these are decisions we have that we can make ourselves, and is it something that we want to consider, and is it something we can do ourselves? Is it something we need a little bit of help with? And those, and then looking at how and where we go for the help in order to make sure that the life that we're living is as long and healthy as possible.
Yeah, definitely. Yeah, that would be really helpful. I found an excellent article on the alcohol change website, specifically around alcohol and menopause, which I think is
Brilliant.
similar to a lot of the things that we've said, but I can share that on the YouTube channel as well.
Yeah.
We are going to do one final Two Doctors Chat Menopause before Christmas, aren't we? Talking about the side effects of HRT.
Yes.
So we will share when we've got a date sorted for that. So we're very much looking forward to that, because that's such a common topic
Yes.
that comes up, or worries about that, or experiences of that. So I'm looking forward to talking about that. Before we finish, just had one question about the impact of HRT on the liver and kidneys. And I suppose, because obviously I think I mentioned that in relation to supplements, I think really important to say that, transdermal HRT does not implicate the liver or the kidneys in any sort of negative form, apart from if somebody had, severe active liver disease. We might be more, and they were unwell with it, we might need to be a little bit more mindful or cautious around doses. But certainly there's no negative impact on the liver function or kidney function. It's very safe generally to use in
don't need
patients.
to monitor those things.
No monitoring at all.
If someone had really abnormal liver function tests, we'd probably discuss with a liver specialist if we were considering what would be the best thing to do, and we wouldn't use an oral HRT.
Definitely, yes.
But taking it through the skin, we would just make sure that what we were doing was taking it through the skin, which doesn't impact upon the liver. But obviously there was something extremely unusual, then we'd need to just run it by a liver specialist.
But yeah, for the mainstay, it's not something we would be concerned with.
We're
Somebody healthy.
Probably not discussing this topic in today. That's probably a big topic to discuss, isn't it?
Yeah, definitely.
Okay.
But yeah, perfect. So thank you so much, Carys. I hope you have a lovely rest of your evening. It's been lovely talking about this, and looking forward to seeing you soon.
Yeah, absolutely. Same to you. Thanks so much, Rachel. See you soon.
Thank you everyone for watching. Thank you for those of you who have joined in live. Take care. Bye bye.